is learning established in a person? By means of a simple and strict mental association between, in one side, a word, and in the other side, the form. It is simple because with just one word, we're able to describe something that can be as plural and diverse as, for example, a tree. So, when a child asks his mother, "Sorry, Mom, what is that big green thing that we've got in the yard?" And the mom says, "Kitty, that's just a tree." At that moment, there's a fast and clear association between, in one side, the word, and in the other side, the form. So the kid says, okay, whenever someone talks about a big green thing, they'll be talking about just a tree. Okay, but now let's try to see how plural and diverse can that tree description be. When we talk about a tree, we're talking about a total of 60,065 tree species registered in the planet in November 2017. And a total of 7 billion trees in Spain, small but very nice country, 2015. But I do understand that it needs to be strict because we use language in order to communicate ourselves. And when we use language, we need to have rules. So a tree must just simply be a tree. But the problem of all this is the enormous simplicity to which we reduce the descriptions when they're already classified within the world of forms. All that we've been talking about is described in a limited language with just one word, the tree. But what we're not aware is that language is just a simple pointer in order to communicate ourselves. In many occasions, we associate a form with an objective, and our mind does not give for more. So we have pre-established that this form has only one direction of use, and there we stay. So we're not able to jump the border of that conceptual image, and so we cling to that relationship. Like this, there are lots of examples in our everyday life, such as Coke. Everyone knows Coke. But in the beginnings, the Coke was designed for the treatment of morphine addiction because its inventor, John Pemberton, was a war veteran suffering from this addiction. Nowadays, we've got regular Coke, Diet Coke, Zero Coke, Cherry Coke, Strawberry Coke, Vanilla Coke, lots of Cokes. And they have nothing to do with the first intention of the product. We've got a lot more of examples. This one, everyone knows it, Viagra. Viagra, at the beginning, was designed for the treatment of cardiac disease, angina, or hypertension. Nowadays, the use is completely different. And it's also one of the pharmaceutical products that generates more money worldwide. It is curious how the mental association prevents us from crossing the border of many uses. It blocks us in what we have conceptually pre-established. My father was an orthopedic surgeon, and the first surgery I attended was when I was 17 years old. They were operating a hand, and the situation in general impacted me enormously because of the fact that I saw a person that at first sight seemed completely healthy. And they caused a wound in his hand, and because of it, they removed the problem in a tendon that they previously had diagnosed. Do not ask me about the surgery. I had enough to stand and not to fall down that day. But I had the chance to attend to lots of orthopedic surgeries. And if I think nowadays about that moment, there are some facts that I'd like to recover, such as the patient was completely asleep. Nothing to do with the kind of surgery they were going to perform. He was relaxed and asleep. And the area of the intervention was perfectly accessible for the surgeons. They just had to sit down comfortably around the leg or the hand or wherever they were going to perform the surgery. No problem, relaxed, just sitting down there. But if we compare those situations, those positions with us, you can see there are lots of difference. In dentistry, the area of intervention is completely different, and sometimes our backs suffers. But we have lots of differences. When a patient is given a hip prosthesis, he knows that he won't walk again until 6 months after the surgery. And it's a fact. There's no negotiation at all. But now my question is, whenever we make a surgery in which you have made the extraction of 20 teeth, you have placed 14 implants, and we have made regeneration of hard and soft tissue, what is the first question the patient asks us? Can I have dinner tonight? And then we're surprised when some implants fail. But we still have a lot more differences. We work in an area which is always wet. It is always contaminated. And it's impossible to avoid the trauma by repetition of the cheeks and tongues when they feel a foreign body entering in their natural habitat. We attend to lectures all over the world. And what we're looking for is just for simple things. Simple things that can be applied in our everyday life and with which we can improve our working conditions or results. So I think about it a lot, and I brought this example for you. This device, you all know this device, used throughout life as a retainer after orthodontic treatment. But believe me, with just small changes, it can be so much more. If we cover the palatal site after obtaining a connective tissue graft or a free gingival graft, we will be able to isolate the palatal. So, we will reduce the trauma by repetition of foot and tongue. And so, we will reduce the bleeding. We will have less discomfort, postoperative discomfort for the patient. And for sure, we will reduce the contamination of the intervened area. But we can also use this Essex as a guide in order to avoid the inflammation after regenerative surgery. And it's easy. You just have to take some impressions after the surgery, and you will increase the thickness of the whole intervened area in just 3 millimeters. So that will be the space that we will allow the inflammation to take place. So we will reduce all the complications of this kind of surgeries with inflammation. But now, let's try to go way too far. What do you think about immediate loading? Great surgery, great results, very comfortable for the patient, very aesthetics. But we always have the same problem. Once we finish the surgery, everything is beautiful. But now it's the time for the occlusion. We always have the problem with the occlusion there. So my question is, what do orthodontics do whenever they want one or more teeth not to touch during their treatment? They place occlusal tops and they stay calm. Maybe the patient, not that much, 3 months, very uncomfortable. But the orthodontics have no problem. And what do we do after immediate loading? When we want one or more professionals not to touch during the months of osseointegration? We reduce the size of those provisionals as much as we can until they're out of occlusion, even though we know that the patient afterwards will regret us because we left those provisionals too small. But we have to do it. But if we place this kind of ethics, we will avoid the trauma of a repetition within the occlusal forces. No contacts means no problem, and for sure, protection. Friends, this was just my example. I'm just trying to go out and think. And I just want you to understand that we really feel very secure inside our comfort zone because we know that the word tree represents a simple form that it's already described in our mind. But as you can see, the complexity is going farther. I just want you to doubt about everything and do not permit your mind to classify everything inside your comfort zone. And only then you will allow the different forms to dance inside your soul so they can freely achieve the direction of use and with it, the end up. In many occasions, the simplest can be the most effective. So, keyword, MIS, make it simple. Thank you very much.